The overarching question this four-person group chose to research was, in adolescents with substance use disorder, how does pharmacological therapy versus non-pharmacological therapy affect suicidality or depression following treatment? Substance abuse in adolescents is a serious public health concern, as the use of illicit drugs are on the rise in this population, and the vast majority do not receive treatment. This group chose to research depression and suicidality due to the fact that suicide is the leading cause of death for people suffering from substance abuse. In order to learn more about this topic, the group searched Cinol and Psych Info using the terms outlined on the poster and reviewed 124 peer-reviewed articles of various levels in order to come to the final 15. These were critiqued and used for synthesis. Each member of the team focused on 5 papers with some overlap to shed light on specific topic related to the overarching question. These included LGBTQ subpopulation, comorbid mental health diagnoses, non-pharmacological treatment modalities, and family support and/or therapy. My topic of interest is comorbid health diagnoses in adolescents with substance use disorder. Preliminary research confirmed the utility of the PICO question, as SUD was found to be the most significant predictor of lethality in suicide attempts. As for my topic of interest, ADHD was shown to complicate the treatment of SUD in depressed adolescents, and group therapy which focused on depression was found to be more effective than general group therapy in reducing substance abuse in adolescents. I identified specific treatment modality in efficacy in adolescents with SUD and multiple co-occurring psychiatric disorders as a gap in the research, and believe that policymakers should ensure that suicide and depression screenings are conducted on all adolescents with SUD symptoms who present to medical and psychiatric facilities.
For my individual interest area, I chose to focus specifically on LGBTQ, lesbian, gay, bisexual, transgender, queer, or questioning adolescents. It is widely known that LGBTQ youth, also known as sexual minority youth, report higher rates of substance use and suicide risk than their heterosexual peers. There are many factors that contribute to these disparities, but many relate to social stigma and the concept of minority stress. Minority stress describes stressors that sexual minority individuals face as causes of health-related conditions. From my article critique, it was obvious that there is a significant gap in research when it comes to LGBTQ adolescents with substance use disorder. Most of the existing literature serves to simply highlight the mental health disparities between LGBTQ and non-LGBTQ adolescents, but there is limited to no high-level research that examines the best substance use and mental health interventions for this population. Studies show that both pharmacological and non-pharmacological treatment modalities are beneficial for adolescents with substance use disorder, but there remains a major literature gap for research of LGBTQ adolescents with substance use disorders. LGBTQ communities that offer acceptance and a sense of belonging are essential for positive mental health outcomes. Because of this, mental health professionals who are competent and comfortable providing care to LGBTQ individuals are a necessary part of care. However, very few mental health professionals are trained to care for this population, and there's little research that studies outcomes of this type of care. Future research should include well-designed, randomized control trials that compare the effectiveness of LGBTQ affirming care in the form of LGBTQ dedicated treatment centers, for example, versus treatment as usual for LGBTQ adolescents.
My area of interest was specifically focused on family support or family therapy as a treatment for adolescents with substance use disorder. According to the CDC, by 12th grade, about 2/3 of students have tried alcohol, about half of 9th through 12th grade students have reported ever having used marijuana, and about 4 in 10 9th through 12th grade students reported having tried cigarettes. This means that a majority of adolescents are using the substances mentioned above. Furthermore, it is significant because substance use can affect the growth and development of teens, including brain development. Familial support or lack of familial support can influence whether or not a teen can recover from substance use disorder. My paper included 5 articles that studied the impact of family therapy on depression or suicidality in adolescents with substance use disorder. Overall, it was found that family-based therapy did not have a large impact on depression or suicidality as compared to treatment as usual. It was also found that family therapy, cognitive behavioral therapy, and treatment as usual all had a positive impact and lowered rates of substance abuse and depression or suicidality. There were no articles found that compared non-pharmacological treatment and pharmacological treatment. It is important to note that Squiglia et al. Found that the Food and Drug Administration have not approved any medications besides buprenorphine for adolescent substance use disorder. All in all, the literature on pharmacotherapy for adolescents with substance use disorder is severely lacking. It is important for future research to study the impact of pharmacological therapy on adolescents with substance use disorder so that they may receive the best care possible.
Between the appraised articles and background literature, non-pharmacological treatments, specifically cognitive behavioral therapy, appear to be the optimal choice for both substance use and depression. Esposito, Smithers, and colleagues investigated the effectiveness of cognitive behavioral treatment methods in adolescents with co-occurring substance use disorder and suicidality. The authors sought to treat substance use and mental health concurrently with an integrated CBT protocol, which involved a combination of classic CBT principles, a family therapy component, and motivational interviewing. They found that, compared to enhanced treatment as usual, the integrated CBT protocol led to less heavy drinking days, less days of marijuana use, and less hospitalizations and arrests related to substance use over the course of the study. Along the same lines of comorbid treatment modalities, a 2017 study by Mulia and colleagues examined the use of CBT plus family therapy on anxiety levels of young adult inmates in a narcotics facility. Despite the fact that the anxiety measures were self-reported, the authors found significant reductions in symptoms following intervention as compared to a general nursing intervention, which involved techniques such as deep breathing and grounding. Furthermore, Kelly and colleagues tested an integrated 12-step treatment specifically for adolescents with substance use disorder and compared this to a motivational interview with CBT treatment. While the researchers did not find significance for the efficacy of the 12-step treatment on the percentage of substance abstinence days, they did find a positive correlation between length of treatment attendance and length of abstinence from substances. This supports the idea of designing a treatment for adolescents that involves long-term follow-up to promote commitment and accountability. Overall, the primary findings of the appraised studies support the implementation of a combined non-pharmacologic treatment modality for adolescents with substance use and mental health issues. By combining treatments, not only will we be able to treat both substance use and mental health at the same time, but we will also be able to specifically tailor treatments to meet the needs of adolescent individuals.